Hello friends, I'm Dr. Anil Ganjoo, a consultant dermatologist practicing out of New Delhi. Today we talk about very important disease called psoriasis and its impact on the quality of life of the affected patients. So today's disease is psoriasis. Psoriasis is a genetic disorder which is characterized by formation of scaly red plaques or patches on the skin. Basically, these patients have genetically determined increased turnover of their superficial layers of the skin, which is called epidermis. So normally our epidermis is, the cells in the epidermis are multiplying slowly and they are moving up and are shed from the surface. This is a normal occurrence. But in patients of psoriasis, this multiplication is much faster and the turnover is faster. The cells move up and are not easily shed off from the skin because the turnover is fast. So because they are not shed off, they collect at the surface of the skin and they form thick patches or thick plaques which are very scaly and itchy, and they can when present on exposed areas of the body, hands, face, feet, etc., can have a huge impact on the quality of the life of the affected patients. And not only physically, they have itching, they have problems with that, but they psychologically are affected because they can't mix up with people. They have reservations. They do not like to go out in public because they don't want to show their lesions. So that way, psoriasis is a very difficult disease. Patients have a lot of psychological problems because of that. So today we discuss psoriasis. I gave you an overview of psoriasis, what it is. It basically is genetically determined. It happens in people who have genetic predisposition to this disease. And then there are some triggering factors like infections, like stress, like exposure to sunlight, like viral infections, etc., or dryness in the skin. All this can aggravate or bring on psoriasis in people who are genetically predisposed to develop it. So we have different types of psoriasis. We have localized psoriasis of the scalp, of the palms and soles, so palmoplantar psoriasis. Then we have the most common variety, which is known as the chronic plaque psoriasis, where we have these plaques happening time and again, coming and going continuously over a long period of time. It can happen in any part of the body, but particularly over what are known as extensors, like on the elbows, like on the knees, like on the feet, like the hands. Scalp is a common place where it happens. Then there are other areas that are involved. You have nail psoriasis. Then you can have joint involvement, particularly tendinitis in psoriasis. Then you have more severe forms of psoriasis, like generalized erythrodermic psoriasis, where more than 90% of the body surface area is involved. You have pustular psoriasis, which comes with pus-filled lesions all over the body. So psoriasis can come in multiple forms and can be quite distressing to the patients. I've already talked about triggers, physical effects. I told you these patients have difficult patches on the exposed areas of the body, which affects their psyche to a huge extent, and they are very disturbed because of this. They don't mix up with people. They have physical problems with physical contact. They have sexual inhibitions. So many things how these patients can get affected. So they are emotionally very stressed out, labile, and psychologically disturbed. And then they have these social challenges, because I told you, if you have something dirty looking on your hand or face, naturally you would not want to interact with somebody. You would not want to shake hands with somebody. So really disturbing, really difficult. This has a huge impact on the daily activity of the patient. So these patients generally get reserved. They do not expose themselves to the public at large. That brings on many psychological conditions. They can be depressed, they can be anxious, they can develop other psychiatric problems. So these patients, in addition to the treatment that the dermatologist gives, need to cope up with the daily stress. They need to meditate. They may need psychological or psychiatrists' help sometimes because their mind is affected to a large extent. So generally, if the patient is suffering from psoriasis, the first thing is that you don't have to panic. Although this is a chronic condition, it is a fully treatable condition, although it does come again and again because it's chronic. But if you keep it under control and you maintain a good lifestyle and follow your doctor's advice, there's every possibility that you may keep it under control for all your life. So if somebody has psoriasis, the first thing he has to do is he has to consult his dermatologist. A good dermatologist will help you treat any kind of psoriasis, no matter how difficult, how extensive the psoriasis is. There are medicines available which include local applications. First of all, we moisturize the skin well in these patients. So moisturization is very important because dry skin can have psoriasis in a very severe form. Then we apply local steroids and salicylic acid, tar. These are the local applications that we give. And then we have oral medication for more severe disease. We have agents like Primilast, we have disease-modifying drugs like methotrexate, like azathioprine, cyclosporin, and then we have the biologics, the injectables one, we have the TNF-alpha blockers, we have the IL-17 blockers, IL-21 blockers. All these are available to us and help us deal with any kind of difficult psoriasis in any patient. So we can bring down the disease burden to a large extent and then keep the patient under control. So once the patient is got under control, then the patient can be kept under control with good moisturization and a mild topical medication that takes care of the disease to a large extent. In addition to the medication, lifestyle management is very important. These patients, one, need to cope up with their stress. So meditation, ways to decrease their mental stress, engaging in activities that lessen the stress, etc., is very important. Also, lately, we have found that psoriasis is an inflammatory condition which can be associated with a number of other metabolic conditions involving the heart, causing diabetes, hypertension, etc. So these patients have to be careful about their lifestyle. They don't have to put on weight. They have to avoid bad food, bad lifestyle, all kinds of lifestyle problems. So which can add to their, psoriasis in the form of metabolic problems. So difficult disease, but not a totally untreatable disease. It's not a curable disease, but you can treat it to a large extent and keep it under control. The best thing is go to your dermatologist as soon as possible, and I think you're going to get good help out of it. I hope I have been able to give you some good information about this difficult disease. Now, if you want to watch more videos like this about psoriasis and about other diseases, please go to our website at dermavidya.com. And please do not self-medicate. Please make sure that you see your dermatologist, who is definitely going to help you out of this problem.
For more such videos, visit or log into dermavidya.com.